What's up, what it is? Welcome to the show. You are tuned into Afterburn with the hostess with the mostest, me, Kelly. And I got my boo thing in studio with me.
The dope boy, DJ Kim Nick D, aka Kim. Welcome to the show, the baddest show this side of the Sahara. It's called Afterburn. DJ Kim Nick D in the mix. And of course, with Kelly, aka Kim, aka the dope boy from Nick D Entertainment, aka the DJ other DJs look up to, aka...
my boo thing. Exactly. I'm always waiting for him to remember. I'm like, Nini, please, this is Nairobi.
I'm focused.
You're focused. Good.
I've been away.
Good. Yes, you've been away.
Yeah,
and it has caused me a lot of...
What?
It's caused me a lot of heartache. It's caused me a lot of...
No, I'm back.
You're back, eh?
Yeah.
For good?
Yeah, for good.
Yeah. You see now men go... They go whenever they want to go and then expect us to be
But
here.
I was not feeling well.
Okay, yeah, it's true, guys.
Good,
yeah, it's true, guys. Kim wasn't feeling too good. He was a bit under the weather, but we are grateful that you're back. Uache kukula nje ya nyumba.
Sawa.
Sawa. Sawa. So today is going to be an amazing show, especially because we're going to be enlightened. Monday Madness is always catching up like over the weekend, but today, honestly, I want us to take care of our mental. So we have a very special guest in studio with us. All right, her name is Dr. Syengo Mutisya. Yes.
Good evening.
Good evening. How are you?
Fine, thank you.
Yeah. Welcome back to now a new version of Afterburn with two new hosts.
Thank you.
Yeah.
Yes.
But you know what? I would love to just get a quick background on you, just to show who our Afterburn listeners who you are. So you are a psychiatrist.
Yes, please.
And how long have you been practicing?
I've been practicing for the last 21 years.
More than
21 years.
Yes, yes.
Wow.
Yes.
And okay, you know what? We'll get into that when we get into the interview, but you've been practicing for 21 years. And have you ever had a moment where you felt like, you know what, I don't want to do this anymore?
Of course, there are moments when whatever you expected for the patient, the recovery, is not as good as you would have wanted. So there are moments which are low, but that doesn't mean you quit, because the preparation in our career is, that's part of the practice, that sometimes you might even lose patients, unfortunately. And so you pick up, you go down, pick up. Yes, but I would want to, even if I was to be reborn, I would still want to be a psychiatrist. Yes.
So do you mainly work with the youth?
Yes, I do. In fact, we have an Nairobi parenting clinic, which basically we have parents bringing their children and adolescents, and also university students coming to seek treatment. We intended it for prevention, but I think in Kenya, everybody only wants to spend money when they are unwell. So we have many people coming in when there are problems. We have referrals from universities and colleges, and also from adults as well. Yeah. Yes.
Okay, that's interesting. How are you able as a psychiatrist to just separate how you feel from how a patient is feeling? Because I could come to you and tell you, my life is a mess. Or siji bwanangu ananichapa, at work they're not giving me promotions, my kids don't respect me, my friends all think I'm a snob. So how are you able to just separate how you're feeling for that patient, that empathy, towards, just trying to help them?
Yeah, actually, that's a very good question, because everybody, each one of us can actually get a mental health condition. And that's why there is now a movement, and research is moving towards training everybody to be mindful, even at work, even in relationships, so that as you move on from one show to the other, you are able to be in the present moment. If you're doing your show, you're enjoying it, and I'm actually enjoying the show. You're in it, and at that time, you live in the moment. Don't worry about the past. Don't start agonizing about what will happen next after the show. So each one of us is encouraged to live in the moment, so that even as I work, I am also able to listen to myself. When I need a break, then I realize I need a break. If I'm overwhelmed by a client's issues, then I would need to sit down and analyze it, either journalize or talk to my own therapist as well, because all of us can be overwhelmed.
So do you also go to your own therapist?
Yes, I'm human. We all have ups and downs, so I'm human.
You know what, I'm glad she said that.
And I also need friends to talk to, I need family members, I need self-care. Actually, on Thursday, all the psychiatrists, we're having continuous medical education on self-care. It's very important because you can only give what you have. If you have an empty cup, even you have an empty cup, you won't entertain us.
What?
Yes.
You know, that's so crazy because people don't realize that. I'm one of those people who, if I see Kim is having an issue, I will try and pour into him. I will constantly try and pour into Kim, and then at the end of the day, he might not be at a place where maybe his cup is a lot bigger than what I have currently in my cup. So even if I've poured out everything to him, it hasn't helped. So you see, as a friend, I would feel bad because I've done everything in my capacity to try and ensure that you're okay. So as you know, as a therapist, now seeing situations like that, how is it that now, okay, let's say Kim is a person coming for therapy, now someone like me who wants to give that kind of support.
Of course, kindness and being able to empathize with other people also gives life a meaning. Because when you come to this show, you come because you will make somebody, you will entertain somebody, you will pass a message, like now you're passing a message which could help somebody. When I was invited for this show, I said, let me go, I might help somebody. So it's good to be kind and to help. But then you need to keep listening to yourself. When you start, after you've listened to my story, then you get overwhelmed, you start crying, or you get irritable. Then you sit down and ask, why is this, why am I feeling like that? Is it because Kim's problems remind me of some problems I've not addressed in myself? Is it because it evokes a fear in me which I have not addressed? So when you're able to question yourself like that and do like a golden thread questioning, then you are able to tell the reason why I'm feeling like this is because this has reminded me of what my brother is going through, or what I felt like some years back, or what I am going through, or I'm afraid to be in the same situation. So when you analyze like that, then you can be able to tell why you felt that way. Because when you empathize, you are not supposed to be drained and dragged into the issue yourself.
Okay.
Yes.
But what about one of those situations where you've realized that now, yes, going back to that situation with Kim and myself, I feel though as though that he's not paying attention to what I'm trying to do. So you see, most people go through situations where, like Sawa, they know their friends, their loved ones, their boyfriends, girlfriends are going through something. You try to be there for that person, but because they're in such a dark place, they can't see that kind of help. They're still wallowing. But now you make it about yourself. You're like, why aren't you realizing that I'm doing this for you? Why aren't you realizing that I'm putting aside everything, you know, probably I'm going through something as well. But you see now that, I feel like that's also a victim mentality. Because at the end of the day, Kim won't understand that, Sawa, I'm doing this, but am I doing that for him because I want him to reciprocate back when I'm also in the pit? Or is it because I'm genuinely trying to help? So you see now, it becomes difficult for people who aren't going through the same mental health issues to understand where now Kim is coming from.
Yes, and you know, in relationships, connectedness and social support is very important in even preventing mental health conditions and preventing suicide. So it is very good for the society to be cohesive and to want to know if Kelly or Ken is not happy, why is she not happy? What can I do for them? But at the same time, as you do that in communication, then if you feel tired, just tell him, I know you're going through something, but right now I'm overwhelmed. Let me take a break, then we can take. We can have a discussion later. So that way the other person is also able to tell, Kelly is not snobbing me, she's just being tired, she'll rest and we will talk. So relationships are give and take. So sometimes you would be willing to talk, but key to preventing suicide is increasing caring, connectedness, and communication. So instead of me jumping into conclusion, you don't want to talk to me because you have an issue with me, then I find out, Kelly, how come you don't want to talk to me? You might tell me, I'm tired, you know, today at work it didn't go well, I need to unwind, because life is ups and downs, and one of ways of knowing that you're mentally healthy is being able to bounce back from setbacks. They will always be there. Adversities will always be there.
True.
So resilience is when you get back from what is putting you down, and you're able to talk yourself back to positive thoughts.
So how would you be able to identify, you know, signs of someone either going into depression or someone on the brink of suicide? How are you able, people who have anxiety, how are you able to break that down and identify them early enough to at least even prevent suicide itself from happening? Because once they're able to talk to a professional like you, as you've said, you become aware. So how are we able to identify it? Is it irritability? Like how should we, people who would love to offer support like that, how do we identify it?
Different people present differently. I encourage men to be able to open up, Kim, so that because men a lot of the times will keep their problems to themselves. They might self-medicate with alcohol and drugs of abuse. But it's very important to be able to reach out when you're not well. But if you're living with somebody, let's say you're very jovial, then you come to show you don't want to do it, you're looking sad, your behavior has changed, your mood has changed, your thoughts are more negative than they used to be. And we need to watch out for people who have had losses. Like if there's a retrenchment, it would be very good to watch out for those people who have lost jobs. For people who use alcohol, you know, alcohol is a depressant, but people think it's just exciting them. But you realize that when alcohol is down your left, your problems look bigger than they were. So it affects your judgment. So people drinking and have problems, then they're at higher risk. And of course, people who have had adverse childhood, people who have been abused domestic violence, like women who, although I know there are also men going through domestic violence. So personality disorder, some personalities are resilience, but some personalities, their mood keeps gravitating. So we need to watch out for those ones. Yes.
And sorry, there's this guy we lost last week. Rest in peace.
Yeah, DJ Lithium. Yes.
There's a tweet he tweeted. He said 6,500 bob for a therapy session is bloody expensive. So my question is, are this guy true and being extreme in charging for these sessions, or?
Yeah, may he rest in peace, and that was sad. What I would say is if you go to the private sector, therapy sessions and of course psychiatric consultations are very expensive. The medication are also very expensive. But then if you do not have a medical cover, or even in some cases the medical cover will get exhausted. Like now in Madari Hospital, therapy session is 500 shillings. Kenyatta National Hospital is also affordable for those who would want to access the government hospitals. And for government hospitals, if you really have no money, there are mechanisms of waiving the bill. So the challenge is if you're not able to afford the private sector, the government hospitals are also there. Yeah, but I agree with you, it can get very expensive. And I hope that it wasn't an issue of cost, so that he wasn't able to talk to someone. Yes. Yes.
But how do you know that someone is at a point where you need to take them for therapy? How do you know that, okay, yeah, you have way too many negative thoughts, Ama, you've lost a drastic amount of weight, you're not talking? How do you identify that?
I would encourage everybody to try and get therapy in one way or the other. Keep talking to your family members, keep talking, even about things you think they are simple, like how your day was at work, what you're going through, the losses, the relationship not working, if you have children, frustrations from children, relationship issues. Keep talking about those issues. They might look small, but again, if you are going through a major transition, like I've mentioned examples like probably relationship not working, loss of job, loss of money. With COVID, many people lost their incomes or business went low, and many people are affected. And also the fact that you can't just party or have fun with your friends, meet up with your friends, that really changed many things. So watch out for some of those transitions. Even if you're not going to a paid counselor, talk to someone. And if you discover that your sleep is affected, your appetite is affected, you don't feel like doing things you loved, like you love DJ, you love presenting, all of a sudden you start feeling, I don't feel like doing this. You play a music, it doesn't ring any bell in you. Then you realize that the things you liked, you're not enjoying them anymore. Yeah, that's a wake-up call, you'd rather be told you're okay. You'd rather be told you're okay than to wait until it's too late.
True.
Yes, yes.
And of course, guys, keep on checking on your friends, Bana.
Yeah.
Keep on checking. I always do.
Yeah, wow, okay. But Catherine, do you feel as though social media has contributed a lot more to the youth either committing suicide, for them getting into depression, for them having even high disorder, just cases of anxiety, because of, on social media, we're all painted as, Kim and I are painted as, lavish celebrities. I would say they don't know what happens on ground.
Yeah, but bowlers, we have
a lot of money.
Amen. We're claiming
because
that.
Because we see you on TV.
Yeah, because they see us on TV, there are all these misconceptions, because people don't see what happens behind that smile in the picture, behind us doing a gig somewhere for him playing in Coast, or they don't see the behind the scenes.
Yeah.
So do you feel as though, because the cases of suicide have gone up to over 500 in the past year. So do you think social media has had a hand in...
Yes. Comparing yourself, judging yourself, or criticizing yourself is now even enhanced more by social media. Because I go to Instagram, I see all these happy pictures, which probably somebody selected the one they were smiling and they didn't put the one they were crying. So you start comparing and thinking everybody is happy. So that makes you compare yourself more, you might judge yourself, which we keep encouraging for your good mental health. Please live your life without comparing yourself to someone else, and also judging yourself or over criticizing yourself. So social media also, you could post something like how you feel, and it turns out people bullying you and making you feel even worse. And also, I was sharing about how media should report such cases, that you shouldn't make other people think that if I was in such a situation, this is the way to go. I mean, this is the way to do it. Ending my life is the way to do it. So even the way we report can actually make people think, oh, this is a heroic thing. But what I would encourage people is, if you feel that social media is making you feel not happy when you watch it, give yourself a break. I know for you people have to use it for work, but sometimes you need to have a break. But again, it's also good to analyze, why am I feeling like that? Am I not, my self-esteem, why does it have to depend on other people? Why do I need validation from other people when I post a picture? Don't I validate myself? So those are things we need to all, these skills many people are not taught in our education system, where we emphasized on the academics, but we needed to learn how to feel our emotions, how to manage, how to have self-control, and self-skills of how to relate, how to make decisions, and how to be aware of yourself.
Okay, now the director is going to be very pissed off because we need to wind up, but I have one question for you. It comes in terms with what you just said with comparison. Now, we all live in the African society, and in the African society, mintambiwa, Catherine amefanya hivi, Kim amefanya hivi. Why are you doing this? There are people in all these high places, but you're not seeing that for yourself. Like, you see, now for people like us in the entertainment industry, we're not valued as serious, you get, because you're a doctor. In the African society, you're either supposed to be a doctor, lawyer, banker, all those kind of serious things. So, I always talk about this, when it comes to people in our industry, we also need mental health insurance. But why is it that in the African society, we've been raised in such a way that, first of all, you don't talk about your mental health? That's taboo. Ati when you've told someone you're depressed, when you mwenda wazimu. Why? You don't, I don't feel good today. Why? But you have all these basic needs. Nobody will ever understand that you could actually just be going through something. You feel like you're in a block. But why is it that Africans do not like addressing such?
So first of all, for any parent, I'm a parent myself, the best thing you can do for your child is to allow them to do what they like doing, because then that makes them happy. Because again, you can push somebody to become a doctor or a lawyer or an engineer, and they end up not being happy, living a miserable life, because they are doing what they don't like. So you do not want an adult who is not happy with their life or with their career, or people who do study and bring the certificates to their parents and they go to pursue their passion. So it is important to allow your children to do what they are good at and what they love. And we all know any career can provide for you.
Yes.
It all depends on how serious you are, how you market yourself, how you network, and how disciplined you are. Yeah. Any career can feed you and can take you places. So for parents, I would encourage them not to compare their children as long as you're reaching your potential. If you're a presenter, do it to your best. If you're a DJ, do it to your best. Then allow people to be who they are, because we've had people who have worked in a certain career for years and they give up and decide, let me follow my passion. So it's wrong to compare and push somebody to do a white collar job. Let them do whatever works for them. Yes. We all have a purpose and every duty. This floor was cleaned by somebody, they were dusted by somebody. We are all very important.
We all can't be doctors.
Yes.
And
we need people to entertain us. Like, I've listened to music, I'm happy.
True, that is true. Yes. But okay, like now on socials, where would we find you? Where would we find your organization? How can we reach you?
Okay. So we have at Nai Mental Health on Twitter, at Nai Parenting on Twitter, and also the same on the Instagram. On Twitter, I'm at Syengo Mutisya, and on Facebook, Catherine Mutisya. Our offices are based in Upper Hill, KMS Center, 3rd floor.
So what exactly is your organization about?
Our organization is for providing and promoting mental health for all age groups. We work with psychologists and counselors, and we also have an inpatient facility. So for those who need it, but most of it is day care and appointments where we can assess what you're going through. You would initially start with our therapist, and they will decide if you need a psychiatrist, you need medication. For those who will need admission, because it can get bad. If you have suicidal thoughts, then you may need admission and you may need medication. So we do a comprehensive mental health care for all age groups. Yes.
Okay. So Catherine, as your parting shot, how would you like to encourage us, the Kenyan youth to seek out help, to talk about their issues, just before it's too late for them and then everyone is left there? Oh, I knew Kelly, oh, I knew Kim, they were such amazing people. So how would you encourage them to just reach out?
Yes, actually youth, we know for youth suicide is the second leading cause of death, and we don't want to get there. So we want to encourage youth to be able to talk, connect, and for us to listen. If you're living with a youth with you, try and hear what they might be wanting to communicate. Sometimes people do not know how to communicate what they are going through. So it is good for the people around you to be able to listen, to be able to find out what they are going through, and to be able to link up for care. If you are in touch with somebody who has suicidal thoughts, and it is not wrong when somebody says they are depressed, to ask them, have you thought of ending your life? That will not make them end their life. So when you ask them that, they might say, oh yeah, at least somebody is willing to listen. Yeah, I've been thinking about it. I've been thinking like my life is not useful anymore. And when you have such suicidal thoughts, then it's good to encourage this person to access treatment. First of all, make sure where they are, they do not have access to means. So like there are no medication available, no, there are somebody who with them throughout so that they are not able to think of even suicide or even firearms. I know there are homes with firearms, and we've had youth commit suicide with firearms, and pesticides, very common. We also appealing to the Ministry of Agriculture to make sure that pesticides purchase and sale is regulated with a prescription, because it's very easy to go and say unataka dawa ya panya, but you want to swallow it yourself. So we need to have that also regulated. But if you're down somewhere, please be encouraged that there's help, and you can be assisted. You stop feeling low and you start, your life has meaning. Yes.
Oof, yes. All our lives have meaning, guys. But thank you so much, Dr. for coming through and at least enlightening us on how we can talk and how to identify. That is like the best. The fact that you can now easily identify through just the methods that you mentioned, just the negative thoughts, the shift in not liking things that you usually would like. That I feel like that's very key. That's very key, because prevention is a lot better than you know, trying to fix something that's
Yeah.
way too hard. But thank you so much, Dr. I, for coming through.
Thank you for inviting me, and I hope that anyone who is suffering could reach out to us and we
Yes.
can see how to help.
Yes, for sure. So we're going to put out all your details on the bumper, and people will be able to reach to you.
Thank you very much.
Thank you so much.
Okay,
So guys, we're
bye-bye.
going to take a quick break, and when we come back, we're coming back with a lot more vibes for Monday Madness, yeah?
True.
True, all right. So stay tuned.